Hi, my name is Kathleen Kobashi. I'm one of the urologists here at Houston Methodist Hospital. I'm here to talk to you today about everything you'd want to know about how to control a leaky bladder. Millions of people worldwide suffer from what we call overactive bladder. Overactive bladder is when you feel like when you've got to rush to the bathroom to go urinate. And people feel like they have to go very frequently, and sometimes they just don't make it in time. We've talked a little bit about this before, but I want to tell you what happens when medications and conservative measures like dietary modification, avoiding things that irritate and tickle the bladder and cause that urgency, or medications that calm the bladder down don't work. So when those things don't work, there are things that we call third-line therapies or advanced therapies, one of which is called neuromodulation. Neuromodulation is a fancy word for like a pacemaker for the bladder. And yes, there is such a thing. It's made by the same team that makes heart pacemakers, and it's the same technology, but it's for the bladder, and it actually helps with bowel control as well. Basically, what it is a little battery that's about the size of like an Oreo cookie or a silver dollar. I've had patients ask me, is it single stuff or double stuff? It's really no stuff, so the thickness is really like 1.5 silver dollars kind of thickness and about this size. And it goes in the lower part of your back or the upper buttock, right, where there's a little bit of extra tissue, a little bit of a fat pad there that you can actually tuck this battery into. And the lead, which is a little wire that modulates the messages to the bladder, goes into an area of what we call the sacrum at level 3. So we call it the S3 for Raymond. Raymond just means opening. That's where the nerve comes out. And that is the nerve that controls your bowel and your bladder. The nice thing about it is you get to take it for a test drive first. So in the office setting, usually we put a little lead, a temporary lead in next to S3, and you wear a temporary battery pack and a little belt around your waist. And again, it's only about this big, so nobody knows it's there, but you and I, and basically you wear it for 5 to 7 days and see if it helps the bladder behave better. And as I mentioned, it also helps with bowel control. So if some patients will have, difficulty controlling the bowel as well, it can be very helpful for both bowel and bladder. So depending on how you do in that 5 to 7 day test period, if it works, which it does about 90% of the time, we will go to the operating room and under a sort of colonoscopy kind of sedation, put the permanent battery in underneath the skin. So it's not because it's a big operation that we do it in the operating room. We do it because we want it to be as sterile as possible. We put it in under the skin, and ultimately you won't have anything on the outside. Another option for neuromodulation is called PTNS, which stands for percutaneous tibial nerve stimulation. Now, we were just talking about sacral neuromodulation, where we actually put the pacemaker in the lower part of the back to stimulate the S3 nerve. That nerve actually starts up in the lower part of your back and travels all the way down your leg and ends in the ankle. And therefore, we can actually modulate those nerve messages from the ankle. Now, traditionally, up until just recently, we would need to trouble you to come in and see us in the office every week for 12 weeks to have this treatment, where we would put a skinny little tiny acupuncture needle in the ankle area and stimulate. Now, however, there are options for an implantable device, similar to the pacemaker we were talking about, but we put it in the ankle. So the device is much smaller, about the size of a nickel, and we put it in the ankle area, and this provides constant stimulation so you don't have to come in every week. Thank you so much for watching. I hope this was helpful and that you got some information about everything you want to know about leaky bladders.